It gives me great pleasure to welcome Paula Dhiman from the University of Oxford today to talk about some of her research over recent years. So Paula is a senior researcher in medical statistics at the University of Oxford, and several of us within TAP have had the pleasure of working with Paula for a number of years now, so it'd be great to hear a bit about your research. So like before, we'll give about 40 minutes or so for the seminar, and then we'll have some time for questions and discussion afterwards. So thank you, Paula. I'll hand over to you.
That's great. Thanks, Kim. Hi, everyone. Thanks for joining me on your, what I presume is your lunch break. So I'm going to just kind of provide a bit of an overview. Did a fair bit of research in the reporting and methodological quality of prediction model studies using machine learning. And this talk is really just kind of a summary of those reviews and of that work that we've all done. A little bit of background. So the rationale for this work was around, the fact that clinical prediction models are used extensively for medical decision making, and we see this in terms of predicting the risk of disease. We see it as for diagnosis, thinking about outcomes and prognosis for patients and to guide treatment decisions. And they're just some of few of ways that prediction models are being used. And we see this as, say, in practice online. Here we've got, we've got risk calculators that we can find in various different ways. We've got the Predict breast cancer prediction model. We've got Euroscore. You've got colon flag. And various others in Q-COVID. And there are many out there that we see and we're interacting with, and patients are interacting with on a daily basis. And so, we're often, and till a few years back, we were more kind of thinking about prediction model in the realms of statistical regression models being used to develop them. But as of late, there's been a great rise in using machine learning, thinking that it offers more flexible modeling, being able to handle big and nonlinear data sets, high dimensional data sets, more complex clinical scenarios. And many prediction model kind of machine learning prediction models have been developed, and we're seeing them that they're continuing to rise at quite some speed. Just going back to these type of models, we're seeing a lot more of them, not only in national guidance, for example, colon flag, but we're seeing it in newspapers. There's a lot of hype about these machine learning prediction models specifically. And just doing a very brief search on PubMed of studies that are using machine learning in the realms of prediction modeling research, we see a very much an exponential growth over the past few years in terms of the studies that are becoming available. Here we're seeing the twice the number of studies using machine learning were published in 2023 compared to 2019. You could even look at it in just the last 2 months, not even 2 complete months yet, January, February of this year, there have been more published in those 2 months than there were in the entire of, if we look at 2014, so 10 years ago, basically, just really to illustrate how popular they've become and are becoming. But there's a slight caveat with this, in that given the amount of machine learning models, prediction models that are out there, very few have actually materialized into patient benefit, with a clear lack of kind of implementation. And we've got studies that are showing that there's actually no real additional performance benefit when using these models, namely around poor design and methodology that's being used when they are developed. And just to say a point here, actually, though, as much as my talk is around machine learning prediction models, a lot of what I am saying is actually not just limited to those. We can actually translate a lot of it over to statistical regression models as well, used in the realms of prediction modeling. But I'll focus on machine learning here. And it just kind of got me thinking about, this kind of hype cycle. And I think just because there has been this great kind of increase in the use of these methodologies and use of these modeling approaches of late, that I think we're kind of sitting around this element of, we're at this point of peak inflated expectations. I don't know if we're still climbing, but it definitely feels like a peak each time I'm picking up a paper these days, of, of what it really can offer. And I think as a statistician, I think I'm kind of more at the bottom here, the trade disillusionment, that actually in reality, that it's not giving us the benefit that we're thinking about, or that we're being told. So a lot of this, as I say, kind of amalgamated together, and it got us to think about, well, let's evaluate this. What is actually going on in these prediction model studies that are using machine learning methods? Now, this is the overall aim of pretty much a lot of the work I'm going to talk about today. And basically, it led to 2 sister reviews being conducted, one which was done in Oxford, which was conducted by myself, and another in Utrecht that we were also involved with as well. And in essence, I'm going to be talking about the results of these 2 studies that were conducted. And together, what we were looking at to evaluate was the reporting quality of these studies, the methodological conduct of these studies and the quality there. We looked at the risk of bias of these studies as well, and also evaluated spin, which is kind of like an overinterpretation of findings, which I'll talk a bit more about in a minute. But so we looked at these 4 kind of dimensions of the studies in a systematic review. And we wanted to say to evaluate each of these components. Quite nicely, this led to 4 papers coming out of the Oxford review, which are all available for you to go away and read. And there were another 4 coming out of the Utrecht review as well, which, as I say, each of these papers looked at each of those components that we were interested in evaluating. Just a few key differences between the 2 reviews, though. So with the Oxford review that I conducted, we focused on cancer as a clinical specialty. We wanted to evaluate prediction model studies that were developing prediction models for cancer in the cancer field, should I say, using machine learning. We were interested in focusing on kind of more low dimensional settings, so more thinking about clinical characteristics as potential predictors in these models. We also wanted to focus on looking at prognosis, so prognostic prediction models, and the papers that we studied, which at the end were 62, were all taken from 2019. The Utrecht review was a little bit broader. It looked at all specialties. It also included some imaging studies as well, so studies using imaging predictors to predict. They included diagnostic and prognostic studies, so that was an additional component there. And they also looked at studies over a longer period of time from 2018 to 2019, resulting in, as you can imagine, a lot more studies. Another key difference between the reviews, so for the Oxford review, we really wanted to focus on author-defined machine learning. I think a few of you might be aware that you could think that there's 2 camps in terms of in the prediction model field. There's the machine learning field, and then there's the statistical regression, is thinking, okay, which one fits where? So we wanted to kind of come away from all of that. We don't really want to think, okay, this is machine learning, this is a statistical model. So we went for more, okay, well, what are the authors? How are they considering their models that they're developing? So we went down that route when we were selecting our studies. And as I say, we weren't interested in high dimensional settings, so we excluded imaging studies. Whereas the Utrecht review, they did exclude the regression-based models. So they really wanted to focus on what you could think of more the typical machine learning prediction models. And they included studies that were investigating, that included imaging parameters as their predictors as well. So there's, as I say, we say that the sister reviews, there were some differences. As I say, in essence, Utrecht was a little bit broader, mine was a little bit more specific, but with some interesting results. For the method side, to evaluate the reporting adherence, we used the tripod guidelines, which is the recommended guidelines for reporting guidelines for prediction model research, consisting of 22 items. There is an adherence checklist that's been published back in 2019, which we used to formally assess the adherence of these studies to tripod, where we looked at the title all the way down to the funding statement and scored whether something was the items were reported or not, and we accounted for study design within that scoring. For risk of bias, we've got the ProBAST risk of bias tool, which what we used to evaluate the risk of bias of these studies. So consisting of 4 domains, you've got participants, so we looked at data source and participant selection. We've got predictors, looking at their definition, the outcome definition as well as timing. And then we had the analysis domain, which consisted of evaluating sample size, handling of continuous predictors, missing data, performance measures, and looking at model availability as well. Then for methodological conduct, we were a little bit more interested, okay, in terms of what are the data sources that are being used, what is the rationale that's being provided for sample size, actually how many models are being developed and what are the type of models. So we just really wanted to kind of gauge what exactly is going on in this field. And we looked at internal validation methods. So once a model's been developed, we then want to evaluate it. How is it being evaluated? And we were interested in how missing data was being handled, and also how was the actual performance of a model being evaluated. We often use discrimination and calibration as measures of performance for a prediction model, where discrimination is looking at the ability of a model to separate the events from the non-events, and calibration, which is looking at how accurate that risk estimate is that the model is actually predicting compared to what's being observed. So this is how we wanted to evaluate the methodological conduct of the studies. And then finally, the fourth facet we can say is looking at spin. And so spin is really evaluating the findings and how they're being interpreted in a study. Specifically, spin links to the over-interpretation of findings, keeping in context with what has actually been done in the study, which we'll see when we come to the finding, come to our results. For this, at the time, at least, there wasn't a spin framework, a framework that allows us to evaluate spin in these studies. We had to use kind of frameworks that were in other fields, but we kind of amended it so it was applicable to prediction model research. And there are 2 papers, the Kemp et al., which looked at spin and prognostic factors in oncology. There was a paper there, and we looked at Boutron et al., which was looking at spin more generally in the biomedical literature. So we used kind of the information and the methods from these 2 studies to evaluate spin in our group of studies. And in essence, we were trying to capture if there were any misleading reporting, misleading interpretation, or misleading extrapolation in the studies. And the way we try to, because arguably this can be a little bit subjective, so the way we try to make it a little bit more objective was come up with some rules to specifically as to what we were looking for in our studies. And so to evaluate spin, we were looking at, was there, an available protocol that was referenced in the paper, in the manuscript? Was there any kind of adherence, or did they mention to any adherence to a reporting guideline? Looking at kind of the appropriateness of using strong or leading words, so things like novel, superior, which we see quite a lot in these type of papers, and looking at whether they were justified or unjustified model comparisons as well that were taking place within these studies, and then looking at inconsistent reporting between the methods and the results. So in the methods, were they saying exactly what they then reported in the results, or was there a discrepancy there? And then also looking at the consistency of reporting between the abstract and the main text. So that was kind of our methodology, and that's how we wanted to evaluate those four key factors that we were interested in. Now, in terms of the results, what did the reporting adherence first look like? So this is basically the adherence to tripod from the 2 reviews. We've got the Oxford one on the left and the Utrecht one on the right. And what we did, we ordered the publications by their adherence, and we looked at it in this step plot. So just going through these 2 plots, what we generally found was that if we were to look at the 50% adherence mark, actually only between 16 to 20% looking at the 2 reviews had 50% adherence to tripod. We're reporting at least 50% of the items in tripod. So it's quite low. And then looking at the median adherence, there was a median of 40% adherence to the tripod items. And studies that had, 100% adherence to tripod, it was about a minimum of 10% looking at across from the two reviews. So generally, from a reporting adherence point of view, it's looking quite low. And then going a step further as to, okay, what were the problems then that we found specifically when it came to reporting adherence was, doesn't want to move. There we are. We've found that there was lower adherence when we were thinking about reporting items around the title of the manuscript, just identifying it as a development study of a prediction model. There was issues there. The abstract generally didn't contain enough information to really give a clear picture of what was actually happening in the main study and in the main manuscript. Predictor information was often missing in these studies, really describing and defining what the predictors were. Sample size was an issue in terms of just reporting what the sample size calculation or any justification. Thinking about comparisons between the development and validation data sets. So if an external validation was actually conducted, so they've developed a model and they went away and they validated it in an external data set in the same paper, very rarely was there a comparison between those two data sets to, again, provide that or much needed context for the comparison itself. The participant flow and characteristics, this was an interesting one, I felt, because it just seemed a bit specific towards the machine learning field, where the participant flow and their characteristics were often unavailable in these studies. Thinking about presentation, interpretation of the full model, that was rarely reported, and model performance as well. Looking at areas of higher adherence, though, they were quite clear in terms of the objectives of the study and the source of data that they were using. That generally was well reported. Thinking about eligibility criteria as well. On that part, we knew, from a patient selection point of view, was clearly reported. Reporting of any risk groups, if they were created, were also, we found there was a higher adherence to that. I'm never not sure what to make of this one, but unadjusted associations, there was a higher adherence of reporting kind of unadjusted associations. I mean, I've got the question marks next to it just because as a more of a methodological conduct point of view, it's probably not a great thing to be selecting your predictors based on unadjusted association. So it's a bit of a catch-22 there, I think, for that one. And then also when it came to limitations and overall interpretation of the results, that all seemed to be better adhered to in terms of reporting items in tripod. Then moving on to kind of the risk of bias, again, looking at the two studies in Oxford and in terms of Utrecht, the more broader review, the findings were somewhat similar again. Largely, most studies were at high risk of bias, and the overall judgment was often, mainly driven by the analysis domain. And we can see that across both of the reviews there, with the two columns at the end of the lower plot and the top and the bottom bar of the plot at the top. So that was another commonality between the two reviews. And then just breaking that down once again in terms of what was kind of leading the higher risk of bias. Again, it came down to sample size, in that not enough data was basically being used to develop or validate the models. The predictors weren't being handled appropriately. This is getting at more the continuous predictors, which I'll go into in a moment. Handling of missing data was often inappropriate, often just excluded. There were issues around model overfitting, again, unsurprising if your sample size is too low. And validation methods were not always appropriate, which I'll talk about in a moment as well. And there were rarely any information given on. So it wasn't just that it was high risk of bias, but actually there was real lack of clarity with some of the studies as well in terms of their handling of complexities of the data, fully providing the performance measures. And here we're particularly looking at whether they gave discrimination and calibration performance measures, and actually whether they reported the full model as well, which I always found quite surprising, because you go through all this trouble, you develop the model, but they're not telling you it at the end of it, which is There's a real shame. In terms of low risk of bias, the data source we found was appropriate for the development of these models and for their validation. And participant selection was also often, we found that was appropriate. So there's a low risk of bias there. Where it came to predictor definition, outcome definition, we found that that was slightly better defined in my review. So the Oxford one around cancer, that was cancer specific. So hence the question mark there being, you know, when it came to looking at it more broader, with the Utrecht review where it's all specialties, this was actually not, it wasn't the same finding. It was slightly more problematic and at higher risk of bias, or it would have been at unclear risk of bias because the information just wasn't reported. So just kind of now branching off from both of those 2 points. So we've got poor adherence, and you've got the poor risk of bias, the high risk of bias for these studies. So what was actually happening? You know, that was what was creating these scenarios. So sample size, as I say, wasn't reported. In terms of actual numbers, we found in the Oxford review, when it came to development, so 85% didn't report their sample size. You know, how they actually arrived at their sample size wasn't reported. And we found that a median of 195 events were being used to develop the model. When it came to validation, it was even a higher proportion that weren't justifying their sample size, with a median of 50 events being used to validate models across these studies. With the Utrecht review, it was very similar. You know, 82% were not reporting their sample size calculations or justifications for developing their model. And when it was reported, the availability of the data was a commonly provided justification for their chosen sample sizes here, with a median of 106 events being used to develop their models. Then there's the issue around split samples. So not only, if you think about it, they're not really using enough of their sample size, what they will then go and do is often split their sample for internal validation. So cutting their data, and often what we found was with the Oxford review, so 40% split their data. Often this was a random split. So, you know, allocating about a median split point of being 70% to develop their model, 30% to internally validate it. And in essence, you're artificially just reducing your sample size that is available then for you to actually develop your model. So again, creating those issues that we found with, especially around the risk of bias with these studies, with 24% using cross-validation to also internally validate. We also found that was kind of similar but slightly higher proportions with the Utrecht review, as again, that's the more broader one, with a range of 10 to 50% used to test. So you could think, you know, 90 to 50%, again, that range to develop their model, with a higher proportion using cross validation as well. And so we found often that not only were they splitting their data, they would also use cross-validation approaches in some instances as well. So they will split it and then use cross-validation rather than just using some kind of resampling approach on the outset, which, as I say, became problematic when it came to evaluating the sample size used for these studies. Again, impacting on sample size, the fact that missing data was, one, not reported, but also where it was poorly handled. And so here we found with the Oxford review, so the cancer specific one, was that 48% actually conducted a complete case analysis, with majority of the studies of the missing data being excluded at study eligibility. So what we found was, where missing data was being excluded, it was actually a very much an intentful decision when it was around the eligibility and just the entry into the study that they wanted. And they would term it as, you know, we took complete cases, or where a full record for the patient was then available. So the terminology really varied as well, how they were saying it, but in essence, they were excluding it. And we found that there was a median, so we calculated a median of around 11% of the data was actually excluded before any analysis was conducted. Slightly lower for the Utrecht review, but I would say generally still quite high, in that 37% excluded missing data at study eligibility when we looked across all specialties, with only 15% actually summarising their missing data there. So, I mean, as I say, this is the reason I'm kind of going into this, is that, you know, there's a real impact here on sample size. And what I wanted to do at this point, because there was this issue of, say, not using enough. And I mean, even in this talk, I've given you a couple of estimates of like what was the median number of events that were being used to develop the model. But when I was doing this study, and what came to me was like, actually, it would be really nice to try and put a number on actually what that, you know, when we say not enough of a sample size, but how much is enough, or how much isn't enough, or how far are these studies off hitting that kind of recommended number, would we say. So I'm going to take a slight detour here onto a third review, just because I probably haven't confused you enough with all the reviews that we've done. But I conducted another one where I was just really interested in looking at machine learning models again. And what we did, we reviewed these ones that were published in December 2022. And our interest here was just to evaluate how much data they're using to develop their models, and how close or far are they from a recommended sample size. So what we did was we calculated a post hoc sample size calculation for these studies using the Riley et al. Formulae for sample size in prediction model studies. And we then calculated then the difference between what was actually being used in these studies compared to what we think would be the minimum recommended number, just to kind of gauge, you know, as I say, how close or far these studies are from that minimum, what we think is the minimum required sample size. And what we found here was actually there was a median deficit of 302 events that were being used. So there were around 302 events generally, you know, too far off the minimum required sample size. So that deficit was too low with these studies. And probably more than anything, it was looking at the range, the interquartile range of this, that, you know, it's anywhere up to, you know, 1,000 events too short to being 14 events too high in terms of the numbers that are being used to develop these models. So this review was looking at machine learning models, and I'd actually done another review just because I was interested in kind of just opening this up a little bit more. But if we were to look at just comparing this to more statistical regression models, so there's a paper that's been published on this, but what we found in that study was that even with statistical, you know, more the regression-based models where they're being fit as prediction models, even there was a deficit, but the deficit was quite a bit smaller. So whereas in the machine learning realm, we're about, if you think about 302 events, you know, of too short when we're developing our models. With the regression-based models, we found that we were 75 events, you know, too short when we were developing our models there. So I just wanted to go on this little detour just because, you know, I think I was always asking the question when I was going through and just thinking, yeah, we're saying, you know, that the sample size is too small, but what do we mean by too small? And I thought this was a good way of just putting some numbers to that deficit. And say deficit seems to be in both fields, that we're just generally not using enough data, but seems to be definitely more problematic for the machine learning field based on these two reviews here. So going back now to the main two reviews, so the Oxford and Utrecht review, you know, we also found that there was inappropriate handling, you know, of continuous predictors, and, you know, really through the fact that a lot of them were categorizing their continuous candidate predictors. We know that a lot of the methodology used in the machine learning field, they implicitly categorize their predictors, even just through the modeling approach. Think about random forest, decision trees, etc. There's an implicit kind of function that will categorize the candidate predictors. And we tried to kind of decipher that a little bit in that we accounted for those methods, which will just be naturally categorizing their predictors. And we also looked at actually how many studies categorized their predictors actually before anything was modeled. So outside of that, so it was more of an explicit categorization, and that's what we found here. So this 39% categorized their continuous predictors done before any modeling was actually done. And then fine, you're going to categorize, but then actually a lot of the studies were very unclear about how they went about that categorization. Again, similar findings when we're looking more broadly across the specialties. You've got 69% the handling actually of their continuous predictors were unclear. And you've got 22% categorizing all of some of their continuous predictors, with, again, very few offering any rationale as to why they're doing it or how. Let's say it becomes a problem for any kind of replication should we want to do anything. And then looking at, discrimination versus calibration, and how these are being reported. So we can argue that these are possibly the two most important metrics when we're evaluating a prediction model. And we found very similar things, what we find in more the statistical research as well, in that very high or comparatively higher levels of reporting when it comes to discrimination, thinking about the AUC, thinking about, the C statistic. Those estimates were often reported in majority of studies, but the calibration is where it all kind of falls apart, with very few, so 18% reporting calibration when it comes to specific studies, but even looking more broader, it drops even more. So 70% reporting discrimination, looking across all specialties, and 13% reporting calibration, which is a real problem because you're just not painting the full picture then of how the model is actually performing. So it's very much a one-sided story if they're not reported completely. And then, I thought this was always one of the striking results, really, what I found, and this was off the Oxford review, but that only 45% of these models that were being developed in these studies explained how to actually use their model. And when I talk about how to actually use it, you're thinking about presentation of the full and final, whether it be a regression based, but model, whether it be through reporting the decision tree, or whether a code or there was some link or some reference to a web calculator that was provided, but that just wasn't given in majority of studies, which, as I say, is surprising because you think you go through so much trouble to develop these models, and then not to report it. You almost do the whole, so it just becomes research waste. It's unusable, really, which is a real problem here. And then just moving on to now spin. So this is now considering kind of the context that I've shown you in terms of, reporting quality, methods quality, considering all of that, how are these studies then actually reporting their results? How are they interpreting them? And as I say, through spin, we looked at, the availability of protocols. So whether these were published or unpublished, that's absolutely fine. But we were looking at, if they reference anything in their studies, and actually no study protocols were found for any of the 62 studies that I reviewed, with only 3 out of 5, 5 studies used a reporting guideline, but only 3 of those 5 used the recommended reporting guideline, which was tripod. Others tended to lean towards strobe for reporting their studies, probably thinking about their data source, I would think. Thinking about reporting consistency, again here, there were some issues. It was mostly consistent reporting, which is good, but we did find that there were 13 studies conducting additional analyses. We also found there were 2 studies that were selectively reporting their results. So an example here is that there was a study, one study we found that didn't specify the comparison between an XGBoost machine learning algorithm and a logistic regression model in their method section, but they reported that in that comparison in their results. But they, as I say, there was that discrepancy there, and that did they set out to do that? I don't know. Or was it something that they just did off the cuff, which is probably more likely, just because it wasn't pre-specified even in that manuscript. There was another study that developed 4 models in their method. They talk about that, but then go on to only report their most robust model in their results section. So again, selectively reporting what they consider their most robust, which I assume was going to be their one which had the highest C statistic. Looking again then at studies that were comparing models, so not only comparing, if you're comparing just the models that were developed in the study, but actually comparing to other models that had already been published in the field. This kind of includes both of those type of model comparisons. So there were 36 that compared it with, 32 of the 36 studies that compared models. Then we've got 20 that identified a better performing model, but without any explicit comparison. So again, there was a sentence that usually used to crop up in the results or the discussion where there was our model is better, but without actually an explicit comparison. And this was quite common in the studies. An example here where that's happened. So there was a study that reported in their discussion that their SGB, so the stochastic gradient boosting model, achieved superior performance on both cross-validation of the training set and testing in the independent holdout set, without actually reporting the comparison of the models. So that, again, it was just a sentence that appeared without any kind of additional information that's been provided where a comparison had actually been done. So these very ad hoc sentences that we found. None of the reported comparisons, none of the studies that were comparing models within their study reported it as an aim, which I thought was a problem. And none of them counted for comparisons in their sample size calculations as well. There were so few sample size calculations anyway, so why would they do one around comparisons? I don't know. And wherever there was a comparison, the AEC was the common, metric to use to compare if something was better or worse. There was no mention of calibration there either. And then this one with 32 that compared to previously published models, there was only one study that formally actually compared it in their analysis, but majority kind of declared their developed models to be better, with even fewer giving any kind of reasons as to why that performance would be better. It's just a very blank statement, which really kind of leads on to, there was some kind of inconsistent reporting between the abstract and the main text. I thought the most striking thing was the fact that the range of models that were developed changed. So when I counted in the abstract, it was a range of 1 to 29 models being developed, but actually looking at the main text, it was 1 to 6. So again, some real issues around reporting inconsistencies there. And you would think with all of that, okay, maybe there will be some tempered conclusions here, but no, not really. A lot of kind of strong and leading words, thinking about novel, excellent, accurate. And this is where we were getting at spin, We looked at this, as I say, in the context of those initial findings. So there just wasn't that evidence base to allow these kind of strong words to be used, we felt. So as an example, we've got study saying, using gradient boosting machine learning algorithms, it was possible to create a prediction model superior to conventional statistical methods. Again, we see this quite a lot popping up, where there's this real strong comparison between machine learning and then the statistical methods. But as I say, when you actually look at the underlying evidence as to what's been done in these studies, these are baseless, I should say. This was another one that we found was, machine learning is a powerful, albeit underutilized tool in clinical medicine with direct relevance to neurosurgical outcomes research. Again, just a sentence that I picked out from one of our studies where, again, there were very powerful claims, but the evidence just wasn't there to support it. So just some kind of key takeaways from a lot of the work that, that had gone on behind this talk today. I mean, generally, there's a building body of literature that's showing the poor reporting, there's poor methodological conduct, high risk of bias, and highly suggestive spin within machine learning prediction models. And I should, as I say, I like to emphasize that it's not just, typical machine learning. We found this evidence in other areas as well. But there's just some differences that we found in terms of where that high risk of bias is occurring within the machine learning compared to what we would find with more the regression-based models. As I say, there are many reviews showing the same, and we add to this. And really the common conclusions from all of what's been said and what we say from our reviews as well, is like, the sample size are too small. Hopefully I've kind of put some numbers to how small that is. Few studies are meeting that basic reporting. So again, there's a high risk of bias. key one as well, there's the unavailability of the models for any kind of validation or replication work, which is a real problem. And there's real need for methodological and reporting guidelines with some emphasis on the languages that is being used to actually describe these models. And yeah, major improvements in machine learning study conduct and reporting are needed before it can be meaningfully considered for practice. So just as a quick summary, we looked at reporting, methodological conduct, risk of bias, and spin in these studies, and sadly not painting a great picture, not only of their, we're not really performing very well on each 4 of these, but just also the fact that there's quite a lot of variation in practice of how these models are being developed as well. So how do we get to then that plateau of productivity here? Hopefully we're on our way. Really what's needed is kind of reporting guidelines, again, more methods, guidance around this, and really tempered expectations. And in terms of how this is moving forward, we've had Tripod plus AI, which is now it's the reporting guideline for both regression-based and non-regression-based prediction models. Tripod plus AI has been accepted for publication, so that should be out in the coming months. We're also working on Probast plus AI as well, which is in the works. And also looking at, and given the importance of having a protocol available and thinking about all those study design considerations as early as possible, and especially before the study started, we were also working on tripod protocols as well, which will also be a guideline for regression and non-regression based models. And so that is the end of my talk. Just a very quick kind of thank you and an acknowledgement to all the reviewers and the researchers that helped with both reviews and this quite big piece of work. So thank you for your time. Any questions?
Thank you very much, Paula.